what we knew before is that a particular cytokine is very important for the development of hepatocellular carcinoma or the liver tumors. And what we also knew is that this particular cytokine can signal via two different signaling pathways. One is important for tissue regeneration, the other one has been implicated rather in tissue inflammation. And we wanted to investigate if this particular pathway, which has been implicated in tissue inflammation, is also important for the development of hepatocellular carcinoma or liver tumor formation. We used two different mouse strains. One was a normal wild-type mouse, and the other one was a so-called transgenic mouse. And this transgenic mouse expressed a particular protein which blocks specifically that pathway of the cytokine which has been implicated in tissue inflammation. And in both mouse strains we induced liver tumor formation by injecting a chemical agent. And initially we analyzed the response of the liver to the chemical agent, so we analyzed the damage response. And at a later time point we investigated the liver tumor formation, so we counted macroscopic visible tumors, and we also analyzed or we measured the tumor volume by magnetic resonance imaging, and subsequently we analyzed, of course, the tissue by histological analysis as well as the analysis of different downstream signaling pathways. Actually, I was very surprised when we saw these results because the cells in the liver, the so-called hepatocytes, they actually, so we were thinking that they rather employ the first pathway because they express the receptor for that particular cytokine. And we saw a marked difference between the wild-type animals and those animals where this particular pathway was inhibited. In that respect, that first of all, when this pathway was inhibited, we saw more liver damage. And secondly, at a later time point, we saw that there was a huge difference in tumor formation. So these mice, they had much less tumors than the normal wild-type animals. And also in terms of downstream signaling, we analyzed in particular one particular pathway, the so-called beta-catenin pathway. And this pathway is also very important in human liver tumors. So there in patients you find mutations in this pathway. And also in the mouse you find, at least in the wild-type mouse, you find a strong activation of this pathway. And the activation of this pathway was strongly reduced in those animals where we also blocked that particular cytokine pathway. We knew that this particular cytokine pathway is very important for the formation and maintenance of chronic inflammatory bowel disease. And currently at our university hospital there is a clinical trial going on using this particular protein, blocking that cytokine pathway for the treatment of chronic inflammatory bowel disease. And now we know that the same pathway is very important for the development of hepatocellular carcinoma or liver tumors, so that we think that this is a new therapy option for the treatment of these liver tumors. And we think that we might use that in that respect, that in patients where you can surgically remove the liver tumor, that you can give this protein to block this particular cytokine pathway to prevent a tumor relapse, a new formation of new tumors in the liver again.